is my presentation on American Sign Language, or ASL. Okay, I'd like to start off the presentation by talking about what is ASL. ASL stands for American Sign Language, which is a visual language. It is also a manual communication modality, which differs from, say, oral communication. So oral communication would just be speech alone, or like an auditory verbal approach, which would have amplification. So this doesn't have any of that, and it's just completely manual. Also, it's a complex language that employs signs augmented by moving the hands, combined with facial expressions and postures of the body. Also, each country has its own sign language, and each region within the country has its own dialects, just as most other languages of the world. Next, I'd like to talk about the origins of ASL. So the exact beginnings of ASL are pretty unclear, but it is thought that it began more than 200 years ago from the intermixing of local sign languages and French Sign Language. Today's ASL includes some elements of LSF, which is French Sign Language, plus the original local sign languages. Modern ASL and modern French Sign Language are distinct languages, and while they still contain some similar signs, they can no longer be understood by each other's users. So, who uses ASL? ASL is mostly used in the United States and also in many parts of Canada. It is one of several communication options used by people who are deaf or hard of hearing. Many people who have family members that are deaf or hard of hearing also take the time to learn and use ASL. Also, teachers of deaf and hard of hearing children, as well as interpreters, learn and use ASL. So pretty much anyone can learn and use ASL. Next, I'd like to talk about the similarities and differences between ASL and spoken language. Sign languages are based on the idea that vision is the most useful tool a deaf person has to communicate and receive information. ASL is a language completely separate and distinct from English. However, it does contain all the fundamental features of spoken language, such as rules for pronunciation, word order, and complex grammar. Just as certain English words are spoken differently in different parts of the country, ASL also has those differences depending on where you're at in the country, with the rhythm of signing, form, and pronunciation. Ethnicity and age are also a few factors that can affect ASL usage and its variety, which is the same for spoken language. An example of how the two can differ is English speakers ask a question by raising the pitch of their voice at the end, while ASL users ask a question by raising their eyebrows, widening their eyes, and tilting their bodies forward. Learning ASL can be extremely challenging but also very rewarding. If you are a parent of a newly identified child who is deaf or hard of hearing, you can request ASL instruction from your child's early intervention system. To learn enough signs for basic communication and to sign them comfortably, it can take a year or more, so just be patient. You can start learning ASL by attending sign language classes, which are offered in a variety of different places, such as community colleges or organizations and clubs of the deaf. You can also practice your ASL by signing with people who are deaf or hard of hearing and also know sign language. Early intervention of deaf or hard of hearing children can be extremely important. About 2 to 3 out of every 1,000 children in the United States are born deaf or hard of hearing. Over 90% of these children are actually born to parents who can hear. Thanks to the screening programs in place at almost all the hospitals in the United States, newborns are tested for hearing before they even leave the hospital. If a baby has hearing loss, the screening gives parents an opportunity to learn about communication options, and parents can then start their child's language learning process during that important early stage of development. Like I mentioned in the slide before, early language learning is extremely important. The earlier any child is exposed to and begins to acquire language, the better that child's communication skills will become in the long run. The first few years of life are the most crucial to a child's development of language skills, and even the early months of life can be important for establishing successful communication. Although about 95% of children have a hearing screening before they leave the hospital, not all of these newborns who are suspected of being deaf or hard of hearing receive the necessary follow-up evaluations they need to confirm their hearing status. This can lead to a significant amount of time passing with the child's parents unknowing of any hearing difficulties their child may be having, resulting in learning ASL at a later age. I also wanted to take the time in this presentation to talk a little bit about the deaf community. So certain thoughts of the deaf community include deafness is a cultural characteristic, not a handicap. And individuals who are deaf are brought together by their inability to hear. So members of the deaf community perceive themselves as able to take care of their own. ASL is also usually the preferred method of communication within the deaf community, and most forms of amplification are often rejected. Members of the deaf community can sometimes view themselves as being at odds with members of helping professions and hearing individuals in general. They do require an education conducted in their primary language to achieve intellectual and emotional maturity, as well as full participation in society. Education can be really difficult sometimes for those within the deaf community, especially when you're talking about furthering education like college. Gallaudet University is actually really cool. It was founded in 1864 and is the world's only university designed to be completely barrier-free for deaf and hard of hearing students. It has direct communication in both American Sign Language and English. It also has communication access support for new signers, including an immersion program, interpreters, and real-time captioning. There's also an English Language Institute for international students whose first written language is not English. Currently, students are from the United States and more than 25 different countries. So, why is this important to know? As future or current clinicians, it is important to be aware of the different cultures we might come across in patients and families. As referenced in Chapter 10 of Introduction to Clinical Methods in Communication Disorders, to complete reliable and valid assessments, clinicians will need to use information on communication and culture. Contemporary practice requires the audiologist and SLP to consider the unique ethnic, linguistic, and cultural background of the family. So we have to be able to recognize cultural factors that affect assessment and intervention, which is no different for those that are deaf or hard of hearing and use ASL. Thank you for listening. All of this information in the presentation can be found at these websites or in the Introduction to Clinical Methods in Communication Disorders book.